know nursing is the nation's largest healthcare profession with more than 3.1 million registered nurses practicing nationwide. Despite its large size, many more nurses are needed into the foreseeable future to meet the growing demand for nursing care. The U.S. Bureau of Labor Statistics projects that employment for registered nurses will grow faster than most other occupations through 2018. Nurses make up the majority of hospital staff and provide more primary care to patients than any other class of healthcare provider. Of all the students in the healthcare professions, over half are nursing school students. I interviewed my friend Rachel, who decided to become an RN for the following reasons: the huge demand for nurses, high pay, and can work in multiple establishments such as a hospital, a nursing home, home care, a school, and many more. They also have more flexibility in their schedule to maintain their outside life. Lastly, she stated, as a nurse, you will make an impact on others and their lives. She graduated with a bachelor's degree in nursing in 2010. She decided that getting her 4-year degree instead of a 2-year degree in nursing would be better, because the pay is slightly more, and with a 4-year degree, more options offered, such as teaching and also management positions, and some facilities are starting to only hire a 4-year RN, or they will choose a 4-year over a 2-year RN. She gained knowledge by becoming a nurse's aide while she was in nursing school, and also attended many different clinical locations while she was in school, which helped her decide on continuing nursing school. The most important thing Rachel has learned as being a nurse is to have a positive attitude, even if a shift can be stressful. You must have patience and remain relaxed when taking care of others, because others can tell when you are having a bad day. You should never complain of being bored or that a shift is going by slowly, because usually once that is said, it gets busy at times. She also has learned that organization and good communication is a must in providing the best care to others. The type of communication she uses the most is phone and face-to-face. While working on the patient floor, you are responsible for answering any patient concern and questions they have. She then relates information to the doctors and family members by phone. Email is never used because fast and efficiency is very important when caring for others. Rachel encounters a wide variety of ages that she cares for. While working on patient floor, she cares for newborns all the way up to elderly. She enjoys every range, but especially the age range of 10 to 40-year-olds, because they are so helpful and able to make their own decisions and recover quicker than an elderly would. She stated her job can be very emotional while taking care of an elderly, because they usually do not fully recover because their body is not strong enough, and most pass away because of that. Her job consists of equal listening and speaking. Equality of these is very important so the patient and the nurses are both understanding of tasks on getting the patient healthy again and back home. Poor communication is not successful and can cause a disaster or harm a patient. If a nurse is not understanding on what is to be done, she said dealing with the medication is a huge responsibility, and that double-checking of medications before giving them to a patient is often done to ensure that there are not any mistakes of a dose being incorrect that could harm a patient. I have come to the conclusion that becoming a nurse is a good career choice for me. However, nursing does seem to be a lot of responsibility and can be stressful at times, as any career can. I thought Rachel gave me interesting information in which I was able to successfully form this speech. And receiving information on becoming a registered nurse can become very in-depth and can be confusing at times, but in the end will be worth it.